2 remedies remove dental plaque naturally last month. My dental hygienist pointed out stubborn plaque buildup that regular brushing couldn't tackle. Embarrassed by yellow stains along my gum line, worried about potential gum disease, I felt frustrated with my oral care routine's limitations. Then she shared 2 simple remedies that work remarkably fast for loosening plaque and improving overall oral health when used correctly. Dental plaque forms when bacteria in your mouth combine with food particles and saliva to create sticky biofilm. This colorless substance adheres to teeth surfaces, hardening into tartar if not removed promptly through proper oral hygiene. According to the American Dental Association, plaque begins forming within hours after brushing. Within 72 hours, soft plaque mineralizes into calcified tartar that requires professional removal by dental professionals. Bacteria and plaque produce acids that erode tooth enamel and irritate gum tissues. Streptococcus mutans and Lactobacillus species are primary culprits causing decay and inflammation when allowed to accumulate unchecked. Oil pulling represents ancient Ayurvedic practice gaining modern scientific validation. Swishing coconut oil dissolves bacterial cell membranes, while mechanical action loosens plaque deposits from tooth surfaces effectively and safely. Research published in the Journal of Clinical and Diagnostic Research shows oil pulling reduces plaque index scores by 68% after 2 weeks of daily practice. Participants experienced significant improvements in gum health simultaneously. Coconut oil contains lauric acid, a medium-chain fatty acid with powerful antimicrobial properties. This compound disrupts bacterial biofilms while reducing inflammation in gum tissues naturally without harsh chemicals. The mechanical swishing action creates emulsion that traps bacteria and debris, pulling them away from teeth and gums. This process works more gently than abrasive scrubbing while reaching areas brushes miss. Baking soda creates alkaline environment that neutralizes acid-producing bacteria while providing gentle abrasive action. Its fine particles physically dislodge plaque without damaging tooth enamel when used properly. Studies from the Journal of the American Dental Association demonstrate baking soda's superior plaque removal compared to regular toothpaste. Participants using baking soda showed 42% greater plaque reduction after brushing. Sodium bicarbonate raises oral levels, creating hostile environment for acid-loving bacteria that cause decay and gum disease. This alkalizing effect helps remineralize early enamel damage naturally. The mild abrasive properties remove surface stains and biofilm without scratching enamel like harsh commercial whitening products might. This makes baking soda ideal for sensitive teeth. Here are 2 proven methods for natural plaque removal. First, practice oil pulling correctly for maximum effectiveness. Use 1 tablespoon cold-pressed coconut oil on empty stomach each morning before brushing teeth or drinking anything. Swish oil gently for 15 to 20 minutes without gargling or swallowing. The oil will become thinner and whiter as it emulsifies with saliva and traps bacteria effectively. Spit oil into trash can, never down sink drain as it may solidify and clog pipes. Rinse mouth with warm water, then brush teeth normally with fluoride toothpaste. Start with 5 minutes if 20 feels too long initially. Gradually increase duration as jaw muscles adapt to sustained swishing motion. Consistency matters more than duration. Second, create effective baking soda paste for targeted plaque removal. Mix 1 teaspoon baking soda with few drops water to form thick paste consistency. Apply paste to toothbrush and brush gently in circular motions for 2 minutes. Focus extra attention on plaque-prone areas like gum line and back molars. Rinse thoroughly with water to remove all baking soda residue. Follow with regular fluoride toothpaste brushing to restore protective minerals to enamel. Use this method 2 to 3 times weekly maximum to prevent enamel erosion from excessive abrasion. Daily use may damage tooth surfaces over time. The science behind these remedies involves disrupting bacterial biofilms through different mechanisms. Oil pulling uses lipids to dissolve cell membranes, while baking soda creates alkaline conditions bacteria cannot tolerate. However, important safety considerations exist with natural plaque removal methods. These remedies supplement, never replace, regular brushing and flossing routines essential for complete oral hygiene. Oil pulling precautions include never swallowing oil, which may contain harmful bacteria pulled from mouth. People with jaw problems should start gradually to avoid muscle strain.